Thank you for waiting, ladies and gentlemen. Good morning. My name is William Atkinson. I'm the Assistant Editor at Conservative Home, and I'm very happy to welcome you all to the Care Debate, how we can tackle issues in social care to unlock growth in society. And I'm joined on the panel today by Marco Longhi, who's a member of the Health and Social Care Committee in Parliament, Councillor James Jameson, who's the Chairman of the Local Government Association, Amanda Wood, the Head of PR and External Affairs at Community Integrated Care, Victoria Parkinson, Director of Finance and IT at MHA, and Dr. Mark Brooke, leading advocate against disability-related hate crimes. Sorry, Dr. Mark Brooke, CBE, I should say. MBE, sorry. Apologies. Anyway, so social care, obviously, is a huge issue and a huge political football. It's predicted that the number of adults aged 66 or over is going to grow by 43% in the next 20 years, yet the sector already faces a funding gap, it's estimated by some, of at least £7 billion. So working out how we can adapt to a country with a rapidly growing ageing population while being able to keep the public finances in some sort of check is a crucial debate, and one that governments of whatever description and led by whichever party will have to grapple with in decades to come. And so the format of the debate will be, I will ask each of the speakers to make a sort of brief set of introductory remarks on today's topic, and then, depending on how we're doing for time, I might ask a couple of questions of the panel before handing over to you guys for a questions and answer session. I'll take 2 questions at a time, and I do reserve the right, if somebody decides to do a monologue rather than a question, to cut you off halfway through in a very sort of rude manner. But we do want to get as many people to speak as possible, and obviously with a very big panel, we've got lots of people to ask questions of, but also lots of people to get through in answering them. So without further ado, I will stop breaking my own advice on monologuing and pass over to Marco to begin the debate.
Can everybody hear me? Yes, thank you. Good morning. Marco Longhi, Member of Parliament for Dudley North, new intake 2019 in a seat that's never been Conservative. A fairly recent addition to the Health and Social Care Committee, but not a recent addition to the Health and Social Care agenda. I have been a local councillor in a black country authority very close to here for some 20 years, 2 of which I spent as mayor, several years of which I spent as chair of the Health and Wellbeing Board, and even more years spent as chairing the Health Scrutiny Committee. During my tenure as a local government member, I was recruited by the Audit Commission to be one of their inspectors for corporate governance, and as you can imagine, health and social, well, the social care element of it certainly formed part of that. And when that was abolished, I became a member peer for the IDA, visiting several different local authorities, helping, delivering some of my pearls of wisdom, no doubt, as they saw it. So not new to the area. I have also spent some time working as a management consultant in the NHS. I have a rather eclectic background in the private sector as well, which I will not bore you with, but just to let you know, I do have a blend of different experiences that, in a sense, helps inform a view of things that might be perhaps broader than that of someone who's perhaps only ever been in one particular sphere of expertise. I'm a huge fan and advocate for the social care agenda in particular, because it's always seen. I used to think about sort of mental health as the Cinderella service of our health economy, but actually, in a different sort of way, I would say that social care is perhaps even more so. It has such a huge impact on all of our lives. That's not to say, of course, that mental health doesn't, and mental health hasn't suffered from anonymity even though it's been on the words, on the mouths of politicians for some time, it never has actually been given the commitment that it has deserved over the decades. Social care is in the same place. And one thing that I know for sure is that every pound we spend in social care delivers much more value for money to our health economy than we do spending it just in the NHS. Perhaps I'll leave that there, because as you have said and threatened, I'm one of the politicians on this board, and I can speak forever, as you can see. So I'll pause there and allow others a word in edgeways.
That was an education in brevity. Thank you very much, Mark. Councillor.
Thank you very much. Just as a brief intro, I'm James Jamson. I'm Chairman of the Local Government Association. Oh, it's probably a bit far away. Chairman of the Local Government Association, and I was leader of Central Bedfordshire for 10 years. I think it's fantastic that we're all living longer, but that comes with consequences. I also think it's fantastic that those people who have disabilities, who might have died in their teens 40 years ago, are living into their 60s. That's fantastic news, but that comes with consequences in terms of costs, but it also comes with consequences of how do we live and how should we work. And I think I won't spend too much money on all the problems with social care and how we fix it, but I spend more on the opportunity. I think we have got to move from something where the NHS, which is supposed to be the National Health Service, but actually is the National Curing Service, because it waits until you're ill and then tries to fix you, moves to a preventative and early intervention strategy, and it works with local government, communities and people to keep people healthy and to enable them to live the best lives that they can and to contribute to the economy. And if you look at health outcomes, about 20% of them are through the NHS, through medical intervention. About 60% of them are down to your personal choices in the community that you are, so things that are influenced by local government, and 20% is genetic. So if you look at it, investing in stuff that is community-based gives you 3-to-1 bang for your buck in terms of improvements to life compared to the NHS. And I think that's the focus we've got to be on. How can we keep people out of hospital? How can we enable people to participate in community for longer? And it isn't just the people who are over 60. It is that whole gamut from 0 to 90, 100, whatever. And, you know, we should look at people, what can they do, not what can't they do, and how can we facilitate it. I think it's also broader than social care, because you need to look at things like housing. You know, giving people the right sort of home for what their needs are makes a huge difference to the life. And I apologise, I'll give a quick example in Central Bedfordshire. You know, those who've heard it before, but I like the story, is Jim, who moved into one of our extra care facilities at the age of 90. On his 90th birthday, he had 2 birthday cards, early onset of dementia. On his 91st birthday, he had 48 birthday cards. He was going downstairs having a cup of coffee with his friends every day. That dementia had gone. He needed less support than he had before. And you can look at that throughout. If you give people the right support and the right accommodation, you will enhance their lives and you will enable them to participate. I would also say there is a huge opportunity with an ageing population. If I look at my grandfather and I recall him, you know, he died at 68. The last 4 years of his life was spent in bed. He had asbestosis and cancer and various things. You know, my father is still around at 89, and it is only in the last year or two that he's lacked mobility. There is a huge resource for retired people who are time rich, basically, you know, have enough money to live, and can contribute hugely to society if we enable them to and if we support them to. So that's a huge economic benefit. And then I would go to working age adults. You know, again, huge contribution people can make to society if you focus on what they can do. How do we help them to do it? But that needs that mental shift. And that's why social care is so important. I just want to talk briefly about social care workers. I do witter on, I apologise. You know, Social care workers are amongst the lowest paid and the least valued in this country. They are amongst the people who can make the biggest difference to people's lives and should be much more appreciated. And there's a real opportunity to pay them more, to upskill them, to enable them to do more. You know, why can a care worker not be doing some of the functions of district nurse if they're paid to do so? And that has a double benefit. There's a shortage of district nurses, but actually, if you're going to see somebody, the fact that you're there for half an hour or an hour doing 2 or 3 things is socially much better for that person than having 3 different people for 10 minutes. So really, the care workforce, how do we pay them more by enabling them to do more tasks, by upskilling them and by giving them a career? Thank you.
Hey, thank you very much, James. Now I'll ask Victoria, your thoughts?
Lovely, thank you. Good morning, everyone. I'm Victoria Parkinson, the Director of Finance and IT at MHA, the UK's largest charity care provider for older people. As a professional number cruncher and bean counter, it's my job to point out the risks and challenges that we face, which I will do. But today I will also highlight what a partnership between providers and the Conservative Party could do to create a new and sustainable future for people who need care. For those of you that don't know, MHA delivers great quality care for older people in several different ways. We run 88 residential care homes, 70 retirement housing schemes, and 60 community support schemes. We reach thousands of older people with these essential services every day, and to do so, we employ around 7,000 colleagues, supported by 4,000 volunteers. MHA provides added extras such as chaplains in our services and music therapy, which is of great benefit for people living with dementia. We enable people to live later life well in all sorts of ways. This week, for instance, we're supporting an amazing 90-year-old resident who's asked us to arrange a skydive, which of course we will. So let me start by setting out the challenges currently facing organisations like mine. You'll think it's an overused phrase these days, but the multiplicity of issues facing care services add up to an unprecedented crisis on a scale we've not encountered before, even during COVID. If you aren't already aware, we're in the midst of a staffing, recruitment and retention crisis. You'll hear the numbers elsewhere, but they tell a story of a workforce on the verge of exhaustion and burnout, with levels of staff sickness having doubled over the last year. Despite more people coming to work in social care at the start of the pandemic, social care now has more vacancies than we did before COVID. Filling vacancies with agency staff is not efficient, sustainable, or delivering the quality of care that our users deserve. You will know that care as a sector was hit hard by the pandemic, both in public confidence and consequently our occupancy levels. We're on the road to recovery, but it's a long, slow and bumpy road. Our local authority partners who fund the care of many of the residents that we look after are not able to adequately fund the true costs of delivering good quality care. And the icing on the cake, of course, is our current and future operating costs. The impact of staffing shortages and inflation are 2 of the key causes, but it would be remiss of me not to mention energy costs, which have now reached such eye-watering levels that even the most financially secure organisations, such as MHA, will have to seriously consider what we can continue to deliver for older people next financial year and beyond. Government support on energy costs next financial year will be critical, and notification of it can't come soon enough. All of this means that too many old people are not getting the care they need, and services are shrinking while the population requiring support is growing. This is sad news for older people who deserve to be connected and cared for, but it's also equally bad news for the NHS. Access to good quality care also means people are less likely to need NHS help. But I said I would talk about solutions, and I meant it. We have an opportunity, as politicians and as people with an interest in the future of care, to reset and reshape social care. This requires a bold, long-term approach. Thankfully, the Conservative government have already taken steps towards this by introducing helpful reforms which could introduce a fair cost paid for the care that we deliver, a cap on what people are expected to contribute, and better collaboration between health and care. Equally, the care sector can bring solutions to many of the challenges faced across society. We're a sector full of problem solvers, solving issues on a daily basis. First of all, I want to highlight the economic importance of social care, which has already been touched upon. Care is a massive employer in every community, constituency and local authority area, on average providing 2,300 jobs in every constituency in England. Encouraging people to work in these skilled, much-needed roles also stimulates local businesses, with social care currently contributing just over 50 billion to the English economy. As well as delivering economic benefit, we also deliver social benefit to the people who use our services, their families and their communities. The work that MHA delivers prevents people being lonely, improves well-being and allows people to live with dignity. Our second opportunity is the benefit we can deliver to the NHS. The NHS wisely acknowledge that they will never fix the backlogs and the general pressure on the NHS without sorting out social care. Movement between the NHS and care could be far more efficient and effective, and we can work together to deliver that. It is greatly reassuring that Therese Coffey has confirmed that care is one of her ABCD priorities. Achieving this priority will take concerted action. Finally, I believe that the not-for-profit care and support sector could be a model for how we can reform services. If you're looking for transparency, accountability and a safe bet for public money, then come and talk to us. If you want services that are people-focused and values-driven, we tick those boxes and we want to do more. So my questions are we going to keep the spirit of these reforms on track? How do we maximise these opportunities? Are we committed to bold reforms which secure good quality care for everyone who needs it, whilst recognising the skill and dedication of people who provide it? From where I'm standing, we can't afford to let these opportunities slip through our fingers. As part of this, we need to be honest with ourselves, that this is about investment as much as it is about commitment, drive and understanding from government. Reform needs to allow our partners in local government to pay the actual cost of care, reflecting better pay and terms and conditions for the amazing people who work in the sector. Social care is a challenge that the Conservatives have started to resolve, but the job isn't done yet. I urge us to work together to create a legacy that this government can be proud of. Thank you.
Thank you very much, Victoria. Well deserved, thank you. And Amanda?
Thank you. Is that okay? Okay, well, I think a functioning social care system will naturally become more impactful and efficient. And, you know, as Victoria said, using the third sector to deliver this means you definitely get more bang for your buck. But there's such an inherent inefficiency associated with an ongoing recruitment crisis. You know, all of our attention as a charity is focused on, you know, recruitment and firefighting to keep services covered. Just last year we spent an extra 3 million on the agency uplift for premiums, and that is such a lot of potential staff that could be, you know, dedicated and working with us. £3 million extra. So with the stability that better pay and retention would bring, we could deliver not just better care but more cost-effective care. And for example, I recently heard about a lady that we support, and she's seen her support team go from 5 people to just 2, and that's because there's understanding and a great relationship being built with that team that really understand her, as opposed to a stream of agency staff who don't. As not-for-profit providers, we also invest in innovations that reduce public expenditure and improve outcomes for communities. So, for example, we also run the Learning Disability Super League, and that generates 1.3 million of social return and investment annually. And also investing in technology also reduces dependency on paid support and increases the quality of life. So with a more stable workforce as a result of fair pay and professionalisation of the sector and proper investment, we can make a bigger impact in people's lives, and also develop the innovations that reduce dependency on paid support. So by focusing in not-for-profit providers, we can further this work. And I think we could definitely describe the current situation as a totally false economy, you know, where the limits in investment in social care result in far greater negative social and economic impacts on society. Thank you.
Thank you very much, Amanda. And last but certainly not least, Mark.
Hi, good morning everyone. My name is Dr. Mark Brooks, MBE. I work for Dimensions as a quality lead and now advocacy lead, leading on the I'm With Sam campaign and My GP and Me. Back when I first came out as having a learning disabilities, it hadn't been heard of. Now, I'm not going to say how long that was because it'll give away my age. And also, if you detect a northern accent, I'm originally from Stoke-on-Trent, so I will speak clearly. So I lived at home with my parents, and learning disabilities wasn't even heard of. There wasn't even a name for it back then. So struggling, luckily my parents helped. But then as I got older, the condition where I was living, my stepdad was a kind of tough guy. So at the age of 21, I ran away to London with just a black sack and £10 to my name, with nothing else, apart from the clothes on my back, obviously. So luckily my brother was in London and was great support. I actually, for 2 years, slept in his one-bedroom flat on the floor for 2 years, which was good, but also sometimes we worked together as well. So we were seeing each other 24 hours a day, so you can imagine how some days were. So eventually I got help from social services who had supported living and was able to get in a supported living place. In between that, I was struggling to find things to do, like finding a job because I left with no O-levels. I was attending a special school, so they weren't doing. Eventually found help to heard about self-advocacy groups, so got involved with the one in Havering. I've been living in Havering, Romford now for over 30 years, and helped set up a People First group. Then got involved with organisations, and then got my first job with an organisation back at that time called Voice into Action, which did things around the Human Rights Act and other projects. In between that, struggling with benefits, struggling with trying to get a voice, I suppose, until the government came out with the Green Paper, which was around valuing people. So that's when I got my first to have a voice. Then, and like I say, where I am today, I've been with Dimensions for 13 years. I did 7 years as a quality checker, which was going into people's home and actually checking to see if people were having a life, so they were getting the right choices, the right support, but also checking that staff had the right training. And so that was really good. And I'd just like to say, over the years, I've seen things going one step forward for people with learning disabilities and then taking 3 steps back, because something always comes up, a big story comes up, and then you have to restart and charge that battery, which sometimes can be frustrating. And where I am today is I'm advocacy lead, and I also lead on campaigns with I'm With Sam, the campaign raising awareness for people with learning disability and autism around what was a hate crime and how to report it, but also like working with the CPS, Criminal Crime Prosecution, and also training frontline police. We're quite pleased that back in 2019 we trained over 1,000 frontline police officers to how to approach people with learning disabilities, and autism, and like yesterday when I spoke at the event in the evening, I just feel that social care and other non-profit having a rough time at the moment, what with low pay, and it should be better pay, and recruiting dimensions. I've also found it hard. And just to end, I did feel really proud when I actually did get, back in 2019, when I got my honorary doctor. That was nominated by a close friend, around all the work I'd done around hate crime, and then obviously my MBE, which dimensions, wrote in, and yes, I actually got it. So, like I say, I think things have moved forward for people with learning disabilities and autism, but there's still a long way to go, I feel. Thank you.
Thank you very much, Mark. I think before I pass over to questions from the audience, one thing that's leapt out to me from the discussion so far is the importance of improving conditions for people both working within the social care sector and for those for whom rely upon the social care and social care services on a daily basis. So I thought if I could just ask each of the member of the panel to briefly, if possible, so we can get on to questions and answers relatively quickly, what they think can be done to improve conditions both for those working in the sector and those who rely upon it. Marco.
Crikey. I remember when I graduated from university, I graduated in civil engineering, and my starting salary was £9,000. And I was always an engineer. I wasn't actually quite sure what engineer I wanted to be before I chose that degree. What became apparent to me was that I hadn't done my homework, because had I chosen mechanical engineering, electrical engineering, pretty much any other engineering, I would have been seen as a different kind of engineer, and my starting salary would have been £15,000. That is because the perception that civil engineers had was that we basically shoveled concrete, and we used wheelbarrows. And if I actually applied that to other countries, you can probably tell from my name that I'm of dual heritage. My father is Italian, and I actually grew up in Rome, and I left Rome when I was 19. If you train as an engineer in France, Italy, Germany, your starting salary would have been something like £30,000. That is because engineers aren't just described as people who can hold a screwdriver or a shovel. That is because there is this perception and acceptance from society as a whole that they are valued qualifications and therefore valued people. So I'm trying to draw a parallel here. Society as a whole has a problem and an issue with how they look at care work and therefore care workers in a similar way as I think society looked at me as a civil engineer, or even just as an engineer, compared to within the engineering field or even with that of other countries. And I'm trying to think, would it have been the role of government to try and somehow inform the population that actually, no, engineers in this country should be more valued, and specifically civil engineers within that remit? I'm not sure that would be the solution. I think there is certainly a role for government to facilitate conversations, as we are doing now, and certainly make structural changes and be a market shaper. But until we, as a population, start looking at the various roles we fulfill within the healthcare economy and start treating absolutely everybody with the dignity that they absolutely deserve, then I'm not sure where else the solution can come from. a lot of the problems I see in society, ultimately, I believe, are resolved from within the community itself. It's a bit like saying to the police, oh, I have an issue over here with antisocial behaviour, and just blaming the police about the fact that we've got antisocial behaviour, when there can be, as I'm sure you might recognise, multiple reasons that might be causing that antisocial behaviour. And that brings me on to the question of integrated services. Local government, as you can imagine, having been one for a local elected member for some 20 years, holding various different roles, I'm a huge champion of. I think they do a far better job of commissioning things. I think they do a far better job of understanding their local community needs compared to much larger institutions who look at things top-down, i.e. typically the NHS. So for me, a very positive move was the inception of integrated care services and integrated care boards to try and crack that nut, which I think you, Councillor, is it Councillor? You are a Councillor?
I am still.
Yes, still a Councillor, yes.
So, yeah.
To bring about some of those very real change in outcomes that probably what we would describe as the most vulnerable communities that we have amongst us. So we have this awful scenario in which we have some of our most vulnerable members of our communities are being looked after by people who we probably value the least. That has consequences for the workforce. It's a workforce that can become dispirited and can quickly want to move elsewhere, perhaps not attracting the best workforce and most aspiring workforce as well, that we are then putting the most vulnerable people into their hands. So we have a big job at hand here, and I'll be completely honest with you. We're on a journey here, but a lot of that drive and a lot of that change needs to come from people themselves. It is a fact. I think it's about 1 in 4 people would ultimately, in older age, be the recipients of care. That is a figure that is no doubt changing as we all, as you said earlier, living much longer with various comorbidities. But it's about 1 in 4. And that's a perception that you and I will have today. And therefore, as taxpayers, and therefore as taxpayers who will influence us politicians, it is 25% of the population that will be saying social care, social care, social care. Whereas pretty much 100% of the population will know that they will need NHS, or their perception is that they will need the NHS. So the NHS will always be, amongst politicians, that sacred cow that shall not be touched. Here's a statistic for you. When Tony Blair came to government in 1997, he was absolutely right to invest more money in the NHS. But he made a fatal mistake. And that fatal mistake was to not reform it first and then throw money at it. He just literally threw money at it. And it grew. It became effectively the dinosaur that it has become now. It's huge. We now spend, does anybody know how much we spend on the NHS now? Anybody in the room? Put your hands up. No.
I don't, but I do know that unpaid carers save the economy more than the entire cost of the NHS budget.
So when we spent £33,000 million in 1997, I can tell you we now spend £192,000 million. £192 billion. And we talk about these numbers as if they were smarties. It's almost as if it doesn't mean much. £192 billion is the size of the economy of Portugal. Let that sink in. £192 billion is more than several smaller countries' whole economies, whole GDPs, put together. The NHS is the largest employer in Europe, 1.3 million people. And yet, you will hear that we are short of staff. You will know that it's difficult to book a GP appointment. Why? What's going on? You will have heard, perhaps if you follow these things, the current chair of the Health and Social Care Select Committee, Jeremy Hunt, former Secretary of State for Health and Social Care, banging the drum about us needing a workforce plan. Yes, of course we need a workforce plan, and I think that's probably widely regarded. But in which other organisation can you think of do you see politicians having to intervene, whether it be public sector or private sector, having to intervene and say, there is an issue with your HR function. There is an issue with you employing the right number of people in the right areas. Do we go to councils and say, you need more teachers or you need more binmen? Or do we go to Jaguar Land Rover and say, you need more people on the shop floor? Why are we doing this? Why are we doing this when we've got the largest employing organisation in Europe and probably the top 5 on the planet? There are some real questions we need to ask in terms of how we reform the NHS and start placing much more focus on delivering health and well-being in the community. And if we achieve that, we're on to a path to solution. A final point, building on your point earlier as well, is the NHS will always need more money because we will always live longer and with comorbidities. So in a sense, although you might infer from my comments that I'm perhaps a little bit critical of how we're going about or how the NHS is managing itself, because we've got a huge cadre of chief executives and managers, which I will one day discover what they do. Well, they should, shouldn't they? Yeah. But it is, in effect, an organisation that the better it does, the worse it is for itself. And I can't think of many other organisations in the world that do that. So we all want to live longer and with better qualities of life. But the more we think about it being just an NHS solution, the worse it will be for us, because it has to be, rather than a medicated solution, it has to be a community solution. And hence why the ICSs are so important, hence why the third sector is so important. Just look how all of us, including the NHS and the third sector, came together over COVID, and how quickly we reacted and how much better we did at bringing the community together and delivering better outcomes for the community in an integrated way. So we can do it. The question is, why don't we do a lot more of it on a more routine basis?
Thank you, Margaret. I think looking at the time, I won't move straight on to the questions and answer session and then make sure everybody gets a chance to contribute then once we move into that area. So what we'll do is I'll take a couple of questions at a time, and then if you want a particular member of the panel to answer those questions, then I'll pass them on to them accordingly. So do we have some questions, ladies and gentlemen? So we'll take the lady in the glasses at the front here, and the chap in the glasses on that side.
George Footing, I'm here representing an organisation called Voluntary Matters, who work in communities across the United Kingdom, mobilising and creating projects with and for volunteers in their local communities. And my question is for you, James, in a sense, and perhaps for the rest of the panel if they have ideas about how we could strengthen the Social Value Act in local government procurement and tendering, because having set up and run my own social care provider, I realised that actually that very rarely are social care providers, rated or audited on their ability to engage in the community and provide that enrichment for well-being and that non-clinical intervention outside of our residents' homes, and therefore I would suggest that we don't make enough of the Social Value Act in procurement for that reason. So, and maybe by doing that, we would help to kind of redefine and reshape the focus on social care as we all hope to do.
Thank you, sir. I think once we've had the other question, I think James and Amanda, if you could provide the gentleman with an answer on that one, I think that would be a good idea. Amanda.
I'll be quick, but it's part one, part two. Part one is key worker homes. In Surrey, I'm chair of the Adults and Health Select Committee in Surrey County Council, and when we get people who actually want to accept jobs, they go away and try and find whether they can actually afford to live in the donut counties, like Essex, Hertfordshire, Berkshire, but particularly Surrey, where recently my division was on the news for the relationship between earnings and house prices. The second one, which is really the question I want to ask, is about the charging reforms. It's an absolute disaster for a county like Surrey, which had large numbers of self-funders. We've now got thousands of people who we've got to try and fund. And the timescale and the resourcing we've got to do to find assessors to do these thousands of people, we haven't got the time. So at least delay the time, even if but financially we can't cover this. So I hope that these outlier counties like us are considered when you're working on these charging reforms.
Thank you, Amanda. I think I'll ask Mark and Victoria to handle that one. And Mark, if you've got some thoughts as well, we can come back to you afterwards. So, first of all, Councillor, the question from the gentleman.
I really like the idea of social value as part of contracts. I think as councils and as in public procurement, we need to think of our tendering much better in terms of how we ensure that we get more bang for our buck, so we don't just get a building built for the lowest price, but we also, for instance, get apprenticeships, we get the employer working with the local community, and I've seen very clear differences in my own local authority where we have somebody who takes it very seriously and frankly for negligible additional cost to them to deliver some real value. I, however, have a slight problem with things like the Social Value Act, in that I do not like councils being told how to do things because it restricts how we can best do things. Now, I think councils want to do the right thing. We don't have to be told to do the right thing, and if we're not doing the right thing, we shouldn't be elected. But the social value is really important, but just don't prescribe it too much because we end up in a box-ticking exercise and we'll get people tendering with tick box here, tick box there. We want real social value, and we want, if you'll have different suppliers that have different abilities, different capabilities, different projects, and they might be able to do an outstanding job in this particular area, and it might be in biodiversity this time, and it might not do anything for, people with learning difficulties, and the next person may have a different skill set and different abilities. So as much freedom as possible, but that social value is really important. And I'm just going to quickly go on the social care reforms. The LGA is very clear at this time when we are completely constrained in our capacity and our funding. I have no problem with the social care reforms. I think they are good things to do, but now is not the time. When we have a funding crisis, if there's any extra money, it needs to go to the front line in delivery, not into a whole load of care reforms that will distract us at a time when we don't have the money. There are some, they're called trail finders, I call them pilots. Let's see what these pilots generate. Let's learn from them and then do it.
Thank you, Councillor. Amanda?
On the first one, I think if you're using the third sector, you're basically using organisations that have, you know, they're values driven, they have those at the core of what they do. So the third sector make sure that all of that money is working to deliver social value. But I think, you know, you can't talk about social value before you talk about co-creation and ensuring that the people who we're supporting are really first and foremost and, you know, are given choice and their choices are respected. So, you know, co-creation of services with users and families and ensuring people have choice first and foremost. And with the second one, the social care reforms, yeah, love the idea of workforce development, but I'm really keen that we have a workforce left to develop. So let's throw some money at it, please. Keep those people on staff. Thank you.
Very well said. So, Marky, on the second question in particular, what did you think?
Could you just refresh?
The first part was key worker homes, and the second part was the charging reforms that outline counties like Surrey. We've got so many self-funded, we've got thousands that have come into the system. We've got huge resourcing to assess them, and we haven't got time to train or even acquire the number of resourcing staff. We need time it's coming in means we can't do it, but even if it does come in, we can't do it. The maths, we're millions and millions of pounds out to sea, we can't do it.
Yeah, so I often, I mean, I'm fortunate insofar as Dudley does not suffer from the very high expensive properties that I know other parts of the country suffer from. You obviously live in a very high demand and beautiful part of the country that is in high demand. That said, it also means that it isn't just social carers that are suffering in terms of the ability to find, and I think you did say key worker, didn't you? So key worker does broaden that. Yeah, key essential workers. It is an issue, and I'm not going to sit here and pretend I certainly don't have a solution. Just sitting here, and I wouldn't want to pretend that I do. And in respect to the other point as well, I think what would be really useful is if you were to perhaps jot these things down as key points for me and email me or see me straight after this, and I will make sure that either relevant minister, or if not even the Secretary of State, gets these points. I know that I have a number of colleagues on the green benches who are the MPs who represent your area, and I often hear them talk about the problem with such high value properties, pricing local people out of their own areas, and it's unsustainable. I just want to acknowledge that, whilst I'm saying I don't have a solution.
Thank you, Marky. As ever in British politics, repealing the 1947 Town and Country Planning Act wouldn't be a bad start. But Victoria, thoughts on those questions?
Thank you. Key worker homes, obviously it's something, as a national organisation, something we're aware of. I'm afraid we don't have a solution either, but particularly for the care workers, better pay conditions and terms would be a good start to enable people to afford homes in the area that they live and work. I'll move on to charging reforms. So, interestingly, saying local authorities can't afford that to do the assessments even. We're aware of local authorities asking providers to do the assessments on their behalf. So kind of pushing that responsibility onto us. Unfortunately, we don't have the capacity to do it either, much as we'd like to. And we're all aware of the staffing issues that we've got. On a broader term, the charging reforms potentially could decimate the sector. We're not clear on the level of the detail of how it's actually going to impact us. But I didn't mention it in my introduction, but it's another great big brick wall coming towards us that we've been slightly distracted by the energy crisis, but we know it's coming. We're not terribly excited about it until we've got some more information. Obviously, we want it to work, and we want to support and help and make sure it happens. But we've all got to listen to each other to understand the issues on all sides of the fence. Thank you.
Thank you, Victoria. Do you have thoughts on either of those, Mark? Shall I ask more questions?
Maybe just on core values. Yes, 1,000% across the board for both people we support and staff. Yes, better paying conditions as well for staff, but also as well. I'd just like to add, due to the pandemic, staff and social care went beyond the call of duty, and I was luckily just recently asked to judge the social care awards, ready for the awards night in 2022 in November, and it was just a shame. Some of the stories I read and what people had done was fantastic. I just think it was a shame I couldn't have given everyone an award.
Oh no, they were certainly all deserved one. Thank you. Another couple of questions then. Should we have the lady in pink over here and the lady with the orange hair over here? Sorry, is that orange? Sorry, it's the light. Okay. It's trying to differentiate. I had one. I did have one yesterday when I was desperately trying to differentiate between two gentlemen in blue suits with glasses and tried to find something that I could somehow identify to get them into mind. Anyway, sorry.
Thank you. So I'd just like to come back on the comments about reforming the NHS, which I think quite a lot of us in the room would agree with, and I think that there are real opportunities for those integrated care systems to deliver really well for their populations, but only if the social care provider voice is at the heart of the decision making and the strategic planning. Because, as you say, the third sector is particularly nimble at trying to deliver solutions for complex problems. The question I'd like to ask the panel really is to reflect back on the observations about the government role in helping us to pay our staff better. And that's really because something like 70% of care is paid for by the state. So we're not in a market position quite in the same way we might be if we're thinking about retail or hospitality. We can't increase our prices with the state because our commissioners don't have the money in local authorities to pay more. So the thing that you would naturally do in retail or hospitality is to think about your cost base, make your efficiencies, which we do in the third sector, and then think about the pricing point. We don't really have that flexibility in social care, particularly in the not-for-profit sector where we have probably more of a balance of state-funded customers and private payers. So it's kind of how do we resolve that conundrum when we can't ask 70% of our customers, who are really local authorities, not individuals, to pay in that sense, because those individuals don't have within their gift the ability to increase the rate of per hour or per week. So help us, somebody.
Thank you. Madam?
Thanks very much indeed. I'm Kirsty McHugh, Chief Exec of an organisation called Carers Trust, and we're the UK national infrastructure body for local carer organisations. And these are the organisations that support the unpaid carers. We support about 1 million a year. Question about integration, really, one locally, one nationally. At local level, completely agree with you. Integration is the way to go, place-based, lot of solutions they exist locally. But unpaid carer organisations, third sector, finding it very difficult to get their voices into that ICS table. And it's that typical thing when you've got place-based partnerships, the statutory bodies having the conversation, local authorities, NHS, etc., and others finding it really difficult to get a foot in. And yet, as the lady next to me said, without the unpaid carers, the whole system collapses. And there's been a real move to digital solutions rather than hands-on stuff. Yeah. So how do we get that voice in? And then at a national level, you think about unpaid carers themselves. So I've only been in this job 6 or 7 months, different background, and it's really interesting. You look at it and you think there's this big push, unpaid carers, getting them back into the workforce, a lot of them over 50, they're the missing million, very low level of benefits, etc. However, without their support, NHS and social care doesn't work. So where's the government in relation to that? What do you want the unpaid carers to do?
Thank you very much, Madam. So I think I'll work down the panel in response to those. So James, would you like to go first?
Yeah, we got this question earlier about what do we do about the care workforce. I mean, frankly, there is no silver bullet. The closest thing to the silver bullet is that government needs to put the right funding in place that we can afford to pay carers at least never mind living wage, a coster wage, shall we say. It is just ludicrous. And we also need to provide, I think career paths are really important, because it's one thing to start on, £9 an hour, but if you can see that you're going to be on £12 or £13 an hour in 2 or 3 years' time, you can do the training, It would encourage you to stay in the industry. As we were saying earlier, we lose 400,000 carers a year. That is a ludicrous number. If we provided a career and a path to higher wages, we wouldn't do that. So I think there's a lot to do, and it's a lot of evolutionary stuff, but it starts off with actually having enough funding to pay people a decent wage. One of the things I think in local government that is a huge opportunity is housing and planning. If we plan and build great communities, and this applies to carers, if people are living in houses that are suitable for them at that point in their lives, and I always find it very distressing, I go and knock on doors far too much. No, not enough. I'm a politician, so it can never be far too much. But you go into the suburbs and you three-bedroomed, semi-detached house, garden is overgrown, the house is slowly deteriorating, and you find yourself in there with a sort of 75, 80-year-old lady, normally women because they live longer, and they're lonely because their husband died 3 years ago and he used to drive, and their children live nearish by and they come by one day a week, and their friends have gradually moved into a care home or whatever. They're lonely. It is the wrong place for them to live. I know it's been their home for 40 years. I gave the example of Jim earlier. Move them into the centre of town, easy to maintain flat, have social connections, have other people around who can help them. That is a massive boost, and that's about society, resilience and whatever, and making it easier for carers. And accommodation is really important. And I would say the same thing for disability accommodation. Interestingly, the same for vulnerable children as they leave the children's system. Can we have foyer accommodation for them? So I think thinking about how we design society, not design societies, that sounds big brothers, how we design places and having the right housing and also having jobs near where people live. I'm in Central Beds. A huge proportion of my population commute into London, Cambridge, Milton Keynes. Well, that means they're away 12 hours a day. If they could work down the road, they could still work 8 or 9 hours, but all of a sudden they're home at 6 o'clock. They're able to participate in their community or help their father or whoever it is. So there's a lot about place planning, 15-minute city, that I think would do a huge amount in helping social care in the voluntary sector.
Thank you, James. Can I ask the rest of the panel, can we be relatively brief? Because we've only got about 7 minutes left, and I want to get through everyone. Marco.
Okay, so the point on income we've touched upon already. If I was able to see what the future looked like, I'd be saying, oh, this is what we're going to do. I'm afraid I don't. But you're right. Clearly, by making, a job becomes more attractive when there is a starting salary on there that better reflects what we all perceive the job is valued at. And I do have to come back, unfortunately, to the point I made earlier in my remarks, which is, we will, all of us, need to take a view what we want to value that job at. I mean, of course, everyone in this room is singing from the same hymn sheet. It's everybody out there that we need to persuade needs to start thinking about care workers and people who work generally in the health economy at the front line, I'll say, differently. Society has shifted in terms of valuing other type of jobs, and I could slightly go down the road of being a bit politically incorrect here when I look at senior NHS management roles and what they do being advertised at £70,000 and £80,000. I will not go down that road, but I'm referencing it. I think perhaps some people in this room know what I'm talking about. Again, this is the NHS that has been enabled as a organisation to make its own decisions about what it wants to pay for those roles. We, as a community, need to start valuing people more, and there is a role for government. But to pick on James's point earlier, when you referred to the Act, you just cannot prescribe too much. So it's finding the right balance. The other point I'm trying to remember. ICS, as you can imagine, huge fan. I think it is the right correct direction of travel. I've made some very positive noises about local government up until now. I'm going to make a mild criticism. They, in the 2012 Act, the Health and Social Care Act, it is in that Act that we created health and wellbeing boards. And if you actually read the Act, it states what its functions should be. And one of those functions includes commissioning. I'll bet there isn't a single, or if I might be proven wrong, but it won't be more than a handful of local authority health and wellbeing boards who actually even discharge a commissioning function, because they actually aren't that good at really defining what the purpose of the health and wellbeing board is. If it had done so, on those boards you would have the very people that you're talking about and their representatives. And it comes down to the basic point, which in local government in particular, but actually in most committees anywhere, if you have a very good chairman who understands their remit and is their main driver, things happen. But quite often it's that isn't the case, I'm afraid. So I think health and wellbeing boards could do an awful lot more within local government than they do, and would perhaps be ahead of the curve in terms of where I think you are talking where we should be. But otherwise, local government, excellent.
Thank you, Margaret. Amanda?
Well, I'm just going to use the last minute just to talk about political will, because I think it kind of answers both questions. And one of the figures I heard yesterday was 6 out of 7 people will not interface with social care in their lives. So how do we deliver value for taxpayers' money, knowing that only 6 out of 7 people, won't be doing it? Well, first of all, that presupposes 2 things. First of all, it supposes that we can all read the future and we know exactly which one of us will be interfacing, or whether we'll have a brain injury or whether we'll hit a certain age and need help. And it also presupposes, and I find this quite uncomfortable, that only the people who receive it actually care about social care. And I strongly, strongly disagree. And if that's a political basis, and that's a very shaky one, because if that had happened for the nurses, agenda for change would never have happened, and nurses would still be on one band of very low pay. So it might be a little bit of a warning, it might be a little bit of a worries cry, but I don't think social care will be staying quiet for much longer. Certainly I'm on board to help raise the awareness about social care. The Unfair to Care report will be coming out this year again, and we'll be again highlighting that low pay and poor conditions will not be sustainable over the long term. So there needs to be a political will, and that's all I would say.
Thank you. Victoria?
Liz, your question reflects the dilemma that I face on a daily basis of how we get the money to fund the services that we want to provide to our residents and our users. It's a massive challenge. There isn't enough money in the local authority to provide the care that is needed. We all know that. I think we all recognise that. And that has to be the solution. We can't keep going to self-funders and expecting them to increase their subsidy to local authorities. We want to do so much more for the people that work in the sector. We want to professionalise the sector. We want to have equivalent terms and conditions with the NHS. MHA are really good, a real living wage provider, so we're leading in pay. But unfortunately, with the current funding that we get, we cannot afford to deliver the benefits that the workers deserve. And it leads to an unfortunate cannibalisation of staff moving between the NHS and care, which doesn't really help anyone. And I think that then reflects on your point about unpaid carers. We need to value our carers, and unpaid or not, we need to support them in the work that they do. Thank you.
Thank you, Victoria. So we're just coming to the end of the panel now, and I just wondered, Mark, do you have any sort of final thoughts on today's discussion, or how we can improve care?
Well, actually, it's just a short sentence for me. I think the government needs to act now. They know where social care is. They know that it's in a mess. They know we keep going round in circles. Action needs to be done now.
Action this day. Very Chichilian. Ladies and gentlemen, thank you very much for coming to the panel today. Can I have a big hand for all of our panellists? And I hope you enjoyed today's debate. Thank you very much.